the Governor, Mr. Martin Roper, as well as Premier, the Honorable Alden McLaughlin, Minister for Health, the Honorable Dwayne Seymour, and Chief Medical Officer of Health, Dr. John Lee. Thank you again for joining us this afternoon. For you, our listening and viewing public, there will be several statements made and then questions and answers for you on the topic of discussion today, which is the coronavirus. Oops.
Hello, everyone. As this global crisis, COVID-19, rages on, I think we all see around us the various measures that are being taken by countries to, as far as possible, secure the safety, security, and well-being of their citizens. And quite close to us, we've seen just last night that Honduras has closed its borders. Canada has just announced that they will be closing the borders to all persons, but citizens and permanent residents. And there are other examples. Over the course of this weekend, starting on Friday actually, ministers have been meeting extensively with members of the private sector. We've had meetings with the Bankers Association, with the people from tourism, hospitality industry, from the Chamber of Commerce, from Caribbean Utilities Company, Cayman Water Company, the Water Authority, the supermarkets and importers, Cayman Finance, the telecoms, and lastly with private doctors. Over the course of tomorrow, we will meet with the fuel suppliers, Sol and Rubis, and with the insurance providers. We have discussed extensively with all of these sectors of the economy and the community, not just their particular role, but more broadly the implications for the Cayman Islands. And we have discussed with them some of the measures that the government feels we ought to be taking. We've discussed things like food security, the certainty that we will have adequate fuel should other places around us that supply these things close down. And over the course of the next couple of press briefings, I plan to advise the country in more detail where we stand with respect to those various matters. But today, the principal subject that I want to talk about is the decision just taken by the cabinet just a few minutes ago to close the Owen Roberts International Airport and the Charles Colonel International Airport for international passenger flights for a temporary period of 3 weeks, beginning on Sunday, the 22nd of March, 2020, at 11:59 p.m. until Sunday, the 12th of April, 2020, at 11:59 p.m. Obviously, this time period will continue to be reviewed as this crisis and the nature of this crisis continues to evolve. For all destinations, with the exception of the United Kingdom, inbound flights from Thursday, the 19th of March, will operate for returning residents only. Outbound flights will operate as usual through Sunday, the 22nd of March. Flights from the United Kingdom will operate as normal through Sunday, the 22nd of March. With immediate, any person arriving in the Cayman Islands will be isolated for a period of 14 days. Flights to Cayman Brac and Little Cayman will be restricted to essential needs and personnel and for residential travel only. Domestic flights between Owen Roberts International Airport and the Charles Colonel Airport and Edward Borden Airfield in Little will continue. Cargo flights will also continue. The airport will also remain open for any emergency flights and courier and cargo services. The government has not taken it lightly, but we believe that it is in the best interest of the people that we do so. There will be some, no doubt, that will wonder why we have announced it now, but it doesn't take effect until Thursday. But we really do not want to have the scenes, the sort of scenes that I think all of us would have seen on television that occurred at Chicago O'Hare Airport in the last few days, where thousands of people are trying to get, in that case, to get into the country. In this case, it would be to get out of the country. We want an orderly evacuation to occur. Are to come. But we have asked the banks to consider payment holidays or the waiver of loan or mortgage payments. I'm happy to say that they had already considered those things and were happy to make that commitment on the basis that they will be considered on a case-by-case basis. So if you have a loan or a mortgage and you are going to struggle to make those payments over the course of the next few months, please call your loan officer and seek to make the necessary arrangements. I can also say that we've had discussions with Caribbean Utilities Company and with Cayman Water Authority, and both have undertaken not to do any disconnections for the next 60 to 90 days. And both have said that persons who will struggle to make payments should come in, or, sorry, I should take that back. Please don't go in. If you can avoid going in, to contact the relevant officer within the respective companies to talk about making payment, developing a payment plan, or making other arrangements. And the final thing I want to emphasize this evening is the importance of isolation for persons who think they may have symptoms, persons who have arrived in the Cayman Islands over the course of the last 14 days. You owe it to your family, to your friends, and to the community. You have a moral obligation, if you think that you may have been exposed, to withdraw from community activities and to stay at home until a safe period has expired. The elderly among us, those who have underlying medical issues, those who have conditions like diabetes, heart issues, any issues affecting organs, are particularly vulnerable and at risk. The young, by and large, the young people among us will survive COVID, many with little or no real symptoms. But those who are sick already, or those who are aged, are particularly vulnerable. And not isolating, in many instances, will be the same as imposing upon those people a death sentence. Please understand the seriousness of that. So we are encouraging everyone to be as responsible as you can possibly be during this very, very difficult and critical time. For the elderly and for people who have underlying medical conditions, the strong advice is for you to refrain from as much contact as you possibly can with anybody else in the community. Stay at home as far as that is possible. Expose yourself as little as possible to the risk of contracting this virus. I do not know if I can be any clearer than that. The greatest risks are to the vulnerable in this community, the elderly, and those who are already sick or have other medical conditions. We have a duty to protect them. A big part of the reason behind the restriction on travel to the sister islands is because we know that there are a lot of elderly people in Cayman Brac. It is in many respects a retirement community. And we want to restrict as far as possible the spread of the virus into that community, for it will have very tragic consequences. So I hope those messages are helpful to people in deciding how they go about their day-to-day behavior.
Thank you, Premier. I just want to add a number of points to that. I mean, as the Premier has already said as well, we are living in an unprecedented period. This is extraordinary in all our lifetimes, and government on Friday took some robust measures, and today there are more robust measures to help us contain this threat from COVID-19. And I support these measures fully, and I think they are exactly what is needed now to help us contain the threat and look after the welfare and well-being of people on these islands. I also want to just say that we have Public Health England here with us, a three-person team. We've met them this morning. They're helping us and supporting us on testing, and that's a really big advantage for Cayman, that as of today we have the capacity and ability to test for COVID-19 on our islands, the only overseas territory that can do that. I'm sure Dr. Lee will say more on it. They're also helping us with the difficult situation at Health City to make sure we can get Health City back up and functioning as soon as possible. I just want to strongly support what the Premier said about isolation and self-isolation. We have the two groups of people, those on island who, if are showing any symptoms, whether it's coughing, fever, shortness of breath, they need to call the HSA hotline and they need to self-isolate. So stay at home, avoid travel, do not go to work or public areas, do not use public transport or taxis. Ask friends, family members or delivery services to carry out errands for you, and try to avoid visitors to your home. And then we have the category which we've just announced today of people coming into the islands from outside who will be asked to self-isolate for 14 days, as the Premier said. And I think it's really important to underline that government can do so much, and I think government is to its great credit doing a lot. But this is about all of us. It's about individual responsibility, and all of us have a responsibility to everybody on these islands. And what the Premier said about our elderly and vulnerable, however old we are, we all have a responsibility to follow basic hygiene, make sure we're frequently washing our hands. We all need to be doing that regularly. And we also have an obligation to self-isolate if we have any of those symptoms. So I really do want to underline that. I also just want to say very briefly, the civil service has also taken a number of actions regarding staff. So civil servants are able to work flexibly. We're encouraging civil servants to work from home. We are also giving civil servants this week discretion to be at home if they have childcare facilities. We are closing down some non-essential services, so library, museums, and we're redeploying some civil service staff to help us on these high priority issues around COVID-19. We've also taken the decision to bring forward the payment of salaries this month again to help staff. So I just wanted to say that. Finally, again, just to say that this is really important that all of us pull together and help everybody on the islands. We're still seeing some panic buying, and there is no reason for panic buying. We have no issues with supplies to the islands coming in by ship. We have the supermarkets have confirmed they have months and months of supply, so we really do want everybody just to be sensible and look after and think about everybody else as well. Thank you. Sorry, Minister.
Thank you, Governor. My fellow Caymanians and residents, as Minister of Health, it is my privilege to address you today. First, I would like to take this opportunity to once again reaffirm that we continue to do everything possible to ensure the safety of you and your families, of the community and the Cayman Islands on a whole. The global threat of this novel coronavirus, COVID-19, is being grappled with across the world. Cabinet is making proactive decisions to ensure we minimize the impact of the virus in our beloved islands. The latest decisions taken by Cabinet include a ban on public gatherings of 50 people or more. This will also be reviewed depending on escalation. Although it excludes hospitals, pharmacies, and supermarkets, persons are still encouraged to keep adequate spacing of at least 6 feet apart and avoid as much possible peak gathering times where these are concerned. Travel restrictions on persons arriving from the areas as discussed, high-risk destinations are now in place, and cruise ships are blocked for the next 60 days, as already mentioned. In the light of these extraordinary times, I am pleased to see the spirit of Cayman kindness cannot be extinguished. Supermarkets have opened lanes to assist the elderly or disabled when they are shopping for provisions, and neighbors are helping each other. A call center manned by cadets is live today and should provide support to the HSA flu hotlines as well as to concerned members of the community. The number again is 949-6555. I repeat that number, it's 949-6555. In addition, we all welcome the news that Cayman will begin local testing, as mentioned, for the COVID-19 today. Public Health England has told us they're pleased with our efforts, and the National Emergency Operations Center has been meeting daily. Cabinet has approved funds so our medical practitioners have all supplies needed to combat the coronavirus. Government is taking this threat seriously. I can assure you every effort is being made to protect persons and to secure our shores. I understand the uncertain times you're in. However, I reiterate what His Excellency the Governor said, what he said last week. Please be responsible. Rumors and misinformation will not help us tackle the coronavirus. If necessary, we will use the law to tackle those who spread false rumors. Remember, you can check on www.gov.ky/coronavirus to see trusted and up-to-date guidance from the experts. This page is being continually updated and should become your first port of call for the facts. Please do your part to avoid scare tactics and fake news. Our preparedness work is comprehensive. While we ready our defenses, we are also aware that the global situation is changing on a daily basis. This government is not complacent. We will continue to prepare tirelessly, make the necessary decisions required in the best interests of the health and safety of our people. And we ask you, the people of the Cayman Islands, to engage with us alongside this fight. I understand if you may feel worried, scared, or stressed about the serious nature of COVID-19, but we can and will overcome this public threat. I encourage all to familiarize yourselves with the advice on home isolation so that any necessary preparations can be made ahead of time. And if the press wants more information on that, we can provide that also on home isolation. Please refer to, again, www.gov.ky/coronavirus for information in this regard. Again, remember to cover your cough and sneezes, wash your hands often, and avoid close contact with persons, especially if they're showing signs of respiratory illness. Please stay safe, and may God continue to bless the Cayman Islands. Thank you.
Good afternoon. I'd like to make no bones about my first point, which is the government is taking in all and every seriousness the magnitude and the severity of this matter, this threat of the COVID-19 disease upon these islands. This is evidenced by the energy and the amount of effort that's going into the decision-making, the support mechanisms, and the multi-agency working that is working behind the scenes in order to get the country prepared for this. Please be in absolutely no doubt about that. As far as the position that we're in at the moment is concerned, you may have heard the phrase delay, contain, and mitigate. We are through the delay phase because we now have COVID on the island, and so we're in the contain phase. But where we are between contain and mitigate is what we're trying to identify at the moment, and the only way we'll do that is with science and with figures. So we await the results, and we await to see the patterns of results in order that will drive our decision-making process going forward. The reason that will take us from contain to mitigate is when we have evidence of sustained community transmission of COVID in the community. And the longer that we can stay in the contain phase, which means isolating contacts, the more time it will have and the better able we'll be able to face the threat. In addition to that, when we're in one phase, the contain or the mitigate, that also changes how we will make our decisions around testing for COVID. Because if we're in the contain phase, we will want to identify quickly and clearly all the cases that may exist. Whereas when we move into mitigate, as the United Kingdom now has done, you'll find that they're no longer doing any checks at the ports, and they are changing the information that they give to the public, and that will happen here as well. We will change the way we manage the condition, because when we reach that phase, we'll be saying we need a different tactic, and so it will change. Up to date, as you know, we have had tested 5 people and 1 has been positive. The 6th test that there's been so much clamour about was not sent for testing because on review of the requirements for testing it was not deemed to be a case. So that case, it was a non-case. Going through the testing rig at the moment at the Health Services Authority, there are 30 tests from Health City and 14 tests that have been received to the Health Services Authority labs from other people on Grand Cayman. And so we await those results. It is likely that they will be around probably tomorrow morning. They are working their way through the system at the moment. There are questions about the test kits and the numbers available. Test kits really relates to the reagents that are used to put through the PCR or polymerase chain reaction machine. Our first batch that came from PAHO had a supply of around 480 tests. But this afternoon, in a conversation which Public Health England held with PAHO, we have been advised that we need to let them know how many kits will be required, an estimate, and they will be able to provide them for us. So it looks fairly straightforward to put in the next order for that. As far as Health City is concerned, the Governor mentioned two of the Public Health England staff experts, a consultant in microbiology and and an expert in infection prevention and control has been there to help guide Health City through the process of getting the organisation up and running. They met with staff in an administrative part of the hospital and did not pass through the hospital itself. The room had been cleaned and they kept their distance according to the guidance that we all are aware of. The last area I wanted to talk about is really not only now in this particular pandemic, but also historically. It's been shown that the isolation, social distancing, and now, more modern times, we know hand washing is absolutely critical. We've all mentioned it across the panel today, and I want to reiterate it, but not only in science now, but also historically, it's been shown that this is what will help to reduce the transmission of infectious agents throughout the community. So even if you are a fit and healthy 20-year-old, protect the whole community, wash your hands, keep your distance, don't gather together, please. It seems that I think even the Premier was saying today, we're all becoming experts, but make sure that if you're receiving information, it is from trusted sources, you know where they are. We are still seeing falsehoods get out there, and they just need to be quashed and not read. And if they are read, not forwarded. Go back to your trusted sources and use those as your source of information.
If we have any questions from the media, I also have a slew of questions from the public that's coming in, but we can start with members of the media. Kevin? Let's hand up first.
Good afternoon, Kevin Morales with the Cayman Compass. Dr. Lee, I just want to confirm what you said, 30 to 40 tests, right? That have been samples that have been taken for testing?
30 have come from Health City and 14 through the systems of the HSA.
All right, 14. That's what I wanted to clarify. All right, thank you very much. And in terms of mortgages, we talked about. Sorry, Mr. Premier. We had talked about working with the banks to, I guess, make life a little bit easier for those who are paying mortgages. What about people who are renting? Is any sort of similar action being taken for renters?
Well, that is one that we're grappling with, but that's a very difficult thing because there are many landlords and there is no system of rent control in the Cayman Islands. So, with the banks, we can call in all of the bank representatives, and we can come to some sort of arrangement. Much more difficult with respect to landlords. So we're conscious of the issue. It's one with which we're still grappling, but I can't tell you now that we have an answer to that.
All right, thank you very much.
Ralph Lewis, Caymanian Times. Mr. Premier, have you considered closing down the restaurants and bars, similar to what is done in some of the major U.S. states?
It is something that we've talked about, but Dr. Lee is far better able to talk about this than I am. But I have been paying very careful attention to all of these things. So we have adopted a very measured approach to what we are doing. We have at present, that may change when the results come in this evening, but no evidence of community transmission on which to base a decision that we should shut down, we should go into a greater state of lockdown than is currently the case. we are certainly going to review those things. If the results over the next few days indicate that there is significant evidence of significant community transmission, government will be taking some far more aggressive measures than we've done so far.
And as for other people on island who have medical issues that are not necessarily in line with COVID-19 but still feel the need to come into the hospital, what advice should be given to them? What do they need to do to seek out their medical advice?
Please forgive me, I cannot speak for the other healthcare providers on the island. However, if they call up their healthcare provider, I'm hoping they will give them the right advice about what to do. I think that a lot of the healthcare providers, and this is something that is very useful, both in the government sector and in the private sector, I've seen that telemedicine is now an approved thing, so and it is chargeable, so that for the time being, and it probably will not always be so, but for the time being, you should be able to hold a consultation through some telephonic or internet means with your usual provider, which will save everybody any risks that they may be concerned of.
And all elective surgeries and specialist services have been cancelled. Would you be able to elaborate on that for me a little?
Yes, so what that means is anything that can be postponed. So if you wanted to have if you were going to have your hip replaced, or if you're going to have a shoulder repair, but it's not a life-threatening matter, that will be something that will be rescheduled for a later date. But that's across the board. So that's what elective means. So anything that is being done out of choice and agreement with the doctor and the patient will be put off into the future.
Okay, thank you.
Can I take a few questions, or pass a few questions from the public along? Beginning with this one, there's going to be obviously an increase in demand on the internet systems in Cayman. What is being done to communicate with the telecoms company to ensure that they have the increased bandwidth that's necessary, Premier?
Well, we've had a meeting with the telecoms as well, and tomorrow or next day I'll be able to make a much more comprehensive statement about where we are with that. But what I can say in answer to the question is that the telecoms are satisfied that they will be able to cope.
Okay. Another question from another member of the public. What's being done to monitor the churches? This person said that they actually witnessed 2 churches in 2 different districts with over 50 people on Sunday, while there were many others that were closed or doing their services online. So what's being done to monitor those?
Well, it's not just the churches. We had reports from a number of people on whom I will rely, that there was some significant partying on 7 Mile Beach over the course of the weekend, all of these things notwithstanding. So the police are already stretched, but we will ask the Commissioner of Police to have the police patrol areas. We really would hope that people will behave much more responsibly, though. We shouldn't have to be insisting that people obey these rules, because this is about, as much as anything else, self-preservation.
Mm-hmm.
Okay. Just if I could just add, this is about the rule of law, and this now is our law. So if people out there have information that those laws are not being obeyed, they should, in the normal way, report that to the police, and the police will take whatever action is necessary, whether it's a warning or advice. But as the Premier says, we really do want everybody to act responsibly.
Okay.
But I can say positively that I know many churches, and many of them had to really think carefully about how they would do this. Some of them had services online. Some of them had 2 or 3 services for the day, so that they could comply. So I think the majority of people are doing the responsible thing. We just need everybody to cooperate.
I agree with that. I've contacted some of the pastors myself, and some of the information got out late on the weekend, so we'll give them the benefit of the doubt for this weekend. I can tell you that I went to a restaurant yesterday, and when I stepped into the door, they told me I was the 51st person. So they're getting the message.
Okay.
I just wanted to add to that, because just to explain the intent, The intent to limit the gatherings is really about reducing the density. So if you've got a tiny little room and you squash 50 people into it, that is absolutely not the intent. The intent is that everybody should be able to be 3, preferably 6 foot away from the next person. And that's what I would hope to see if you're in church or in any other gathering place of less than 50 people. I would hope to see that spacing. I think even now, I've been seeing that the spacing in outdoor restaurants and things, I've been seeing that the tables have been moved further apart. That's absolutely the right thing to do to reduce the density.
Okay. 2 quick other questions from the public, and then we can move back to the media. One person wanted to say they can't buy personal hygiene products such as wipes and sanitizers or even alcohol, so how are they to follow the guidance, and when are more supplies of those things coming in? Do you know?
Well, I can tell you that I understood that. I mean, I can go ahead and say that Hurley's got new supplies in today, so maybe they should try. Not as that as a public endorsement.
Also,
Can I also add that
yes.
you can wash your hands with regular soap and water.
Thank you,
just,
sir.
Just do it, for an extended period, 20 seconds, 30 seconds. It'll do the same thing.
And it's better for the environment too. So.
and also, if
People are
you,
thinking just when they're mobile, they
Yeah.
don't have access to the soap and water, but the sanitizers.
and also if you have regular baby wipes, if you just add regular alcohol in and pour it in it, it's a good sanitizer also.
Okay, the other question relates to work permit holders. How is this going to affect them with the borders being closed and a lot of them being laid off their jobs? This person wants to know, will they use the word deported, but that's not the word I think that fits in there. Should they have to leave if they have a work permit? Maybe not. If they're laid off and they can afford to live here, then what about that?
Well, let me say this. A decision as to whether or not they have a job is a matter for their employer.
Right.
If the employer cancels their work permit, they no longer have a right to remain in Cape Town. If you don't have a job, we encourage you to leave.
Okay. Reshma.
Thank you. Reshma Raghunath, Kiaman Compass. Premier, to build on the point that you just made, a lot of these employees that are being laid off may not have the finances to return. I know we had something that was called, I think, a work permit bond or something along those lines. Does that even still exist? How are these people going to leave the island if they are no longer employed?
Well, work permit holders leave Cayman every single day. They should use it by their own means. Their employer is supposed to ensure that they have a return ticket. If for one reason or another they don't leave, we do have a repatriation bond, but that is an extreme measure. People should leave under their own steam. They're just leaving earlier. If their work permit was up, they no longer had a job. They would leave in the usual way that thousands upon thousands of people leave every year.
So, just to take us back to the flight changes and the border closing, can you just walk us through what that means? So, if people haven't lost their jobs yet, but they lose their jobs next week, how can they get home? Just explain to us how the flight changes are going to work, the restrictions that you've imposed.
There are, as of, let me make sure I get it absolutely correct, as of 11:59 p.m. on Thursday, we will not accept anyone except returning residents. Up until 11:59 p.m. on Sunday, Sunday, 22nd of March, people are able to leave. Because what we anticipate is that a number of carriers, not just Cayman Airways, will continue to fly to Cayman over the course of this week through to Sunday. Thereafter, the country will essentially be in lockdown for 3 weeks. not for 3 months, for 3 weeks. So people who wish to leave should hustle to make arrangements to get out of here by Sunday the 22nd of April. Otherwise, March. Otherwise, save in